Thanks, Andy.
Good evening. My name is John Eckhart. I'm professor of entrepreneurship at the Wisconsin School of Business at UW-Madison, and I'm also a co-founder of Generator.
Thanks again.
At every major Generator event, we ask a distinguished entrepreneur to come with us and share their expertise and their story. Tonight, we're very honored to have Mark Bakken come and be our distinguished guest. Mark Bakken is what I call a career entrepreneur, not a serial entrepreneur, but a career entrepreneur. He started 3 companies, successfully sold 2 of them, done this all here in the state of Wisconsin, and his 3rd company, Nordic Consulting, which he is currently the CEO of, had $80 million in sales last year, employs over 400 employees. Many of them are very technically sophisticated individuals with MBAs and advanced degrees, and may very well be the fastest growing company in the state of Wisconsin today. Ladies and gentlemen, please join me in welcoming Mark Bakken to the stage. Thank you, Mark. What do you think so far?
It's pretty nice. I think everybody loves, speaking in front of a few hundred people.
It's a favorite.
Absolutely.
So tell us about Nordic Consulting Partners. Where did this idea for the company come from, and what do you do, and why are you growing so quickly?
So a couple of things. What we do is we bill out consultants all over the country. We have consultants working right now in 40 states, working for hospitals, clinics, and healthcare organizations, helping them implement electronic medical record systems. We exclusively work with Epic Systems software. Epic, being based out of Madison, thankfully has huge market share. Their customers currently basically support over half the US population is on an Epic Systems platform. So huge numbers out there, but a lot of work to automate healthcare as far as checklists, standards, and hopefully improving healthcare and reducing costs at the same time.
So you're working adjacent to or next to or helping a very large, enormous company, Epic. And a lot of entrepreneurs, they grapple with this issue, this question of how do I partner with a very large company? And there's definitely some advantages. They can often use that as a sales channel and have a nice partner. On the other side, sometimes entrepreneurs are concerned about being brushed aside at some point by this gigantic thing that has almost infinite resources. How do you think about this? How do you kind of manage your business model around such an impressive and amazing company, but also at the same time building an impressive one yourself?
So we have to augment what Epic does. Epic makes fantastic software. It's been around for 35 years, and thankfully Judy and everyone at Epic has designed it from the ground up to work seamlessly together. That's why hospitals love Epic. It's not just a bunch of best-of-breed applications. In healthcare with Epic, there's literally 50 different applications within it. So think of like Microsoft Office with Word, Excel, PowerPoint. But in healthcare, there's specialty applications for pharmacy, which is dealing with all the different drugs and dosages and specialties that change every day, to lab work, to x-rays, to emergency room, to clinics, to billing, to insurance companies, all those different things. Epic, unfortunately, has a different view of partnering, a unique view, I would have to say, with consulting firms. My previous companies, I worked closely with Microsoft, and Microsoft embraced consulting companies as well as people that could make the Microsoft platform better, could write applications on top of it, could embed Microsoft software and hardware, things like that. Epic, the way to work with Epic is basically make sure you work closely with Epic's customers. So Epic's customers have never worked with Epic before. Our consultants have over 10 years of experience. So about 2/3 of them used to work at Epic. So they have a lot of experience. And because Epic has grown so fast, there's just not enough people that understand Epic out there. So what we do when we work with Epic is we work side by side with Epic's staff as they're implementing. Epic really wants to make sure the customer gets the software deployed, starts training their people so they can use it and they can support it. We come in and make sure it gets implemented correctly, but we also help them learn from each other on how to streamline the software to make it more efficient and more efficient.
Do you think you help Epic sell more systems?
It's a good question. We don't come in on the front end, okay? So what we do is make customers feel better about their decision. They're spending millions, and some customers billions of dollars implementing Epic. So it's a huge, huge investment. It's a huge change for the entire organization. And there's just not enough people out there to help those customers. Think of it like going to IKEA and you're buying some furniture and you're looking at the diagrams and it takes forever basically, or a kid's toy for Christmas. The first time you do it, it takes forever. The second time, you're a lot faster. Third time, you can get it down. But very similar, from a high level where our consultants can come in, work with the healthcare organization staff, their nurses, their doctors, help them understand what's possible, help them agree on the best ways to do it going forward, and get the consensus and then configure it into the system. So when a nurse or doctor comes in, there's basically a series of questions or checklists, and getting buy-in is not always the easiest when dealing with physicians and nurses. They're very strong-willed.
Heard that before.
Yeah.
So one of the reasons why I love working with entrepreneurs is that they're often the people that find themselves in a situation, and all of us find ourselves in these situations where we see a problem, we see a market need, something just doesn't seem quite right. And then entrepreneurs are those people that see that kind of that hole, that gap, that thing that isn't just quite right, and then they do something about it. And what they do is, it's less about trying to get everybody to kind of agree and vote to change something in that respect. They launch a solution. It's a product, a service, something new that hopefully will make the world a better place and will solve some particular need that's directly in front of them. And part of that story is that they get unique information. They see things that other people don't, and that's partly the reason why they act. And in your case, you're literally at the epicenter of one of the fundamental changes that's occurring in the economy with the adoption of the Affordable Care Act and all these different changes in healthcare. And I'm very curious that, what would you like to report back? What do you think this room should know and see based on your experiences about, the fundamental changes that are happening in healthcare, and what are some of the great things that you're seeing, and what are some of the challenges that you see ahead?
So in the last 4 years since I started Nordic, it's been very, very interesting to get to know the healthcare industry and how it does business every day, and how it's embracing technology. Healthcare in the U.S., 1 out of approximately every $5 we all spend in the U.S. is spent on healthcare. It's roughly twice as much as any other of the first world countries out there. Studies have shown that roughly about 30 cents of every dollar spent in the U.S. on healthcare is considered wasted. It's spent on administrative inefficiencies, things that could be automated with technology, care delivery inefficiencies, or even unneeded care. So that accounts to about $700 billion a year that's wasted. So software, as we hopefully all know, is a great way to automate things, from registration. If you can registrate, if you can buy your own airline tickets, things like that. Just think of all the efficiencies that could be had by automating things over and over, things that aren't the best use of anyone's time. With the Affordable Care Act, what it did was it said that the government, and most people don't know this, the government is roughly 60% of every hospital's revenue. So it's a huge customer for every hospital. 60% of the revenue comes from Medicare, which is care for old people, and Medicaid for poor people. So when your largest customer says, listen, no more of this, you can't just charge me whatever it takes and mark it up, basically. The healthcare industry was on a cost-plus basis. And now the government is saying, listen, on average, we know that you should be able to, do this surgery for this amount, and we're going to pay you a fixed amount going forward. So it's flipped everything upside down. And now hospitals and everyone else in the care system has to look at it and say, okay, if we're only going to get paid a fixed amount, and we're going to get a penalty if someone's readmitted, we better make sure we do it right the first time. Before, if we did it, we would just get paid again. The government would just keep paying us. So, not that they tried to do a bad job. Obviously, I don't think anybody's intention was that, but the system would just add up more and more costs. So now everybody's very, very interested in saying, okay, if basically if it costs more, it comes out of my pocket. So the industry is trying to figure out how to deal with delivering care on lower margins right now, and they're looking at software as a way to do that. So let me give you another example that 40% of the time a physician's initial diagnosis is incorrect, which obviously nobody wants to talk about. That sounds horrible, but when you think about it, you know, you go to WebMD or anything, you're like, oh my gosh, I could have any of these things, basically. So they have to start somewhere with
it does mean that 60% of the time they are correct.
That's
so I got to give them that.
That's true. So hopefully, like with data, you could learn from each other and they could hone in a cure faster, basically. So they're trying their best. They're doing a process of elimination, but when all of us had a copay, whether it was $20 when you visit the doctor or it was $2,000 for the year, the physician would typically like, well, I don't think it's this, but let's rule it out. Let's go do that MRI, let's go do that lab, let's go do that test. And every time they did that, they could charge for it. They could charge the government, they could charge the insurance company. You would go, okay, good, at least it wasn't that. But now they're going to be more apt to say, you know what, there's a 99.99% chance, it's not that, so we're not even going to waste our time. By wasting our time, it may have actually delayed, the real cure, which could have caused, more problems, basically. So the whole healthcare system is basically, it's been flipped upside down. When you go from a cost-plus model to a model where it's fixed price, you have to kind of look at it and say, okay, these old bandages that we buy from our supplier for $77, and charge it to the government. Now they're like, well, I'm just going to go to Walgreens and get them for $3 because I can keep the difference, basically. So there's a lot of things going on. And it's interesting, the last 3 years it shows that healthcare typically has gone up 10 to 12% a year forever, historically. And all the projections were that it was never going to end. The last 3 years it's only gone up 2 to 3% or less for the last 3 years in a row, which is a huge curve when you look at anything like mortgages or investments or anything like that. So the economists are saying right now, if that trend continues, that America won't have even a long-term debt problem anymore because of this, because most of America's long-term debt is related to Medicare and Medicaid payments in the future. So who knows if we'll be able to do that as a country, but when you think about 30% of every dollar is wasted, and if you can keep using technology to automate things, maybe we can keep the cost increases from going up going forward. So it's very interesting to see how technology is helping healthcare lower costs, but at the same time, the outcomes are getting better. I was just at the White House 2 weeks ago and got briefed by the Affordable Care Act and the policymakers, and they said for the first time ever, like the infection rates are going way down, and readmissions are going way down. So maybe there's a correlation, but we'll see. But the early indications are looking good from that perspective.
One of the things that, as like an economist, when I hear about these different kind of incentive models that are introduced, and in this case, and I spent maybe several hours actually on this starting off my day in St. Mary's Hospital, is that some of these models are set up where a hospital doesn't get as high of a reimbursement rate, or in some cases, has a sort of a financial penalty if they have a lot of readmittance.
Right.
So someone has a particular procedure done, and then they come back to the hospital, and maybe the thinking is that that wasn't done well. And sometimes what that can do is create an incentive for a hospital not to readmit somebody that maybe should have been readmitted. Is there a role for software to kind of resolve that kind of problem, to make sure that those who need to be readmitted 7 or 8 times for the same issue kind of are readmitted, and those that should not be readmitted, that's a sign of inefficiency, or not readmitted?
Yeah, hospitals are spending a lot more time and resources trying to minimize readmissions, okay? So there's a fine line there. At the end of the day, the patient still gets to decide, and the hospital's reimbursement rates are based on patient satisfaction scores. So there's a lot of crazy paperwork involved in all this Obamacare stuff too. So hospitals are jumping through hoops. Physicians are being asked to do lots of things that aren't the best use of their time. So there's so much opportunity to automate a lot of this going forward. So whether it's helping patients be more accountable as well. So before they come in for a surgery, there's software out there. There's some here in town, Wellbe, that helps make sure they're prepared, make sure their parents or their loved ones know that they did this, 60 days before an operation. Usually you get that stack of papers, and most likely people don't always do the stack of papers before they get to the hospital. And the hospital hasn't been that incented to make sure they do it. So if you can help a patient do that beforehand as well as afterwards with the follow-up visits to the physical therapist or whatever, that'll greatly increase the odds that whatever you're doing, the surgery or anything, will be right the first time and you won't have to be readmitted. There's a lot more initiatives with home health too, where people don't like staying in a hospital. So hospitals are basically incented now to say, hey, let's try to do it right. Let's minimize how much time they're spending in the hospital, and let's get them out there and get them productive as quick as we can.
As I'm sitting here and we're talking together, this keeps popping back into my mind. I have to ask you this, that you went from 4 years ago, $0 in sales, to today, $80 million in sales. Went from having, basically no employees to 400. And these people are all across the United States, and you look great. How does this all happen? How do you manage that kind of phenomenal growth?
It's been incredible growth. When I think about it, I haven't really thought about it. It was always just, let's just do what we need to do today. Let's focus on the customer. Let's focus on our employees. Let's do the right thing. Let's hit another single, hit another single, hit another single. And thankfully, Madison has got incredible people everywhere. Part of it, 2/3 of our people are former Epic, and that helps us a lot. Judy and Epic does a phenomenal job of finding very, very smart people from around the country, and she brings them all to Madison. She requires them to live in Madison, which is fantastic for all of us. But eventually people decide that they're at a point in their life, they don't want to spend the rest of their life here like us. It's cold here for a long time, all that. So they're ready to move on. And when they are, we're here, we can talk to them about consulting, say you have a skill set that's in high demand right now. Maybe you could do consulting, maybe it'll lead to the next thing. Some of them will stay here and help us grow to the next level. Epic's customers have to all come here for training too, so that helps. And then just in general from, the community here, there's lots of great providers that were early adopters of Epic that know Epic inside and out. There's obviously the business schools and others that have lots of entrepreneurs in their blood here. And I think when I look back and say, oh my gosh, this is, incredible, I think it was just staying focused was a big thing. You can get distracted, you have all kinds of people contacting you all the time, and you're like, hey, would love to help you, but I need to focus on my business and keep it going. So I think what they always say, pick an area, try to be world class at it and do it better than anybody else, has been a good thing for us. We got rated #1 in KLAS, which is the equivalent of J.D. Powers and Consumer Reports for the healthcare industry for Epic staffing and implementation. So we focus on our quality. We focus on great people that have the right communication skills and everything else, so we don't need to do a lot of management and everything else.
You make it sound easy. Make it sound easy. So one last question. Just a few moments. These entrepreneurs are going to start presenting on stage and sharing an incredible amount of hard work that they've been able to pack into just 12 short weeks. And one question in their minds that they've shared to me is, and I think it's great to hear people think about this together, is what makes a great investor? If you're an entrepreneur and you're saying look, I've got a long road ahead of me. I'm building a company and I have aspire to do fantastically well with this. What makes a great investor?
So in my mind, a great investor is someone that brings more than just financial resources to the table. They bring connections, they bring relationships. Hopefully they have some industry insight. Maybe they've seen the movie before, so they can help you with scalability and everything else. They can be there for you when you got some tough decisions to make and you're constantly making decisions. Maybe they can help you figure out, your plan B, plan C, plan D, plan E, plan F. Hopefully you never have to go that far. Hopefully they can help you figure out when to exit or when to get another round of financing and how to do that. There's lots of things that they can bring to the table. They can help you find people that can complement your team. When you start, you can't always afford to have, every little position that's out there, but through that network, they're going to know other people that think the way you do, that have the same passion, that'll fit in with your culture, that can help get you to the next level.
Wow, fantastic. Well said. Well, please join me in thanking Mark for being our guest speaker this time.